Okay. Welcome to May 6th, our first Tuesday of the month office hours. My name is Dr. Kasara Andre, and I'm the founder and creative director of a co-working ecosystem for health entrepreneurs called Cultivate Wellbeing. And we hold office hours every Tuesday and Fridays as a space for our community to come and ask weird questions and talk about things that we don't understand and just be in community together. And it's a pleasure on the first Tuesday of every month that Dr. Gewehr, he's the medical director for Veterinary Cannabis. He joins me for a special edition called Veterinary Medical Entrepreneurship. So while Cultivate Wellbeing serves health entrepreneurs of all kinds, as a veterinarian myself and very connected among the animal caregiver world, we'd love to talk about animals of all things. Humans are pretty cool too, but those are animals, but we definitely love our fur kids. So, Dr. Gewehr, do you want to say a quick hello and then toss it back to me and I'll say a little bit more in intro?
Yeah, absolutely. Thank you, Dr. Andre. Thank you, everybody, for joining us today. We have a full room today comparing to the other weeks, and I'm so glad you're here. I'm so glad that we have other specialists and we have other professionals that we can talk about and maybe get some insights. That's the whole point of us teaching something and learning something. I think that's very important. I've been working with cannabis since 2019. I did my final internship, so I did the final stages of my graduation in the US. I've done it in veterinary cannabis in Denver. Ever since I worked for about a year in like the general practice. I also worked with cannabis and also in the educational part in Brazil. That's where I'm from, and that's where I live right now. And after a year working in a general practice, I decided to focus more on cannabis. So I decided to focus on the educational piece. So I launched electronic books, I launched courses here in Brazil, and I decided to pursue a master degree. And I finished that last year. I've done a research with cannabis in anesthesia, where we used cannabis sort of like pre-anesthetic medication, and we saw a reduction in about 23% in the propofol dosage required for anesthetic induction in healthy dogs. I've also published that article. If you want to read it, I'll put it in the chat. And oh, Dr. Andre has already done that. Is that my article,
It
Dr.
is.
Andre?
Yes, it is your article. Please, everyone,
Yeah,
open
thank you.
and read and share a really impactful article that we've chatted about in a couple of other episodes. But I'll just mention that I think this is the first article that really begins to bridge the gap between from the like retail pet store sort into clinical in treatment room. This is how it affects our anesthetic protocol. So, João, I'm always so impressed and proud that you're grateful that you're on our team. Great intro. Do you want to quickly mention some of the things you're interested in now from the AI side? I think our audience might enjoy that.
Yeah, but I have another thing that you
Yes.
mentioned about how cannabis is going to be treated like in clinical trials and about the research.
Mhm.
But one thing that I want to bring up and that I brought up in my research, and I think it's something that most professionals don't realize and that we don't know, is how other medication affect the ECS. And I think that's one of the most interesting pieces for me is that it's not actually related to cannabis, but to the ECS. Like all professionals are affecting the ECS. I'm talking here about anesthetics. We have a number of articles that indicate that propofol acts on the endocannabinoid system, diazepam acts on the endocannabinoid system. I don't know if I'm pronouncing that
Yep.
right, but isoflurane, sevoflurane, volatile anesthetics act on the endocannabinoid system as corticoids, opioids, anti-inflammatories. So we have a number of medications that act on the ECS, and I just think that's very interesting because we all modulate the system somehow, right? I know the topic that we're going to talk about today is more about the cardiac piece, not exactly about the anesthetic, but I think it would be very interesting to see some research evaluating that. If maybe cardiac medications work on the ACS also. And about the AI, I'm an enthusiast. I don't work. We are talking about testing an AI program which is going to help us to filling out forms. about anamnesis and how we can actually keep the documentation up to date.
Hmm.
And it's just a way to automate it. Just a software on where we can record the conversation that we have with pet parents, and it already summarizes the symptoms, treatments, medications, and just keeps everything up to date and everything automated. So we don't have to keep filling that up because I know that can be very time consuming. And I don't know how it is in the US, but at least here in Brazil, we are having more and more lawsuits related
Mm.
to veterinary cases. And one thing, at least here in Brazil, that I don't see a lot, I know Dr. Andre is a very nice example on how to do it. It's record keeping. I
Mm.
remember even when I was in the US, she was teaching me how to do it. I don't, I didn't learn to do it as good as her, but something here in Brazil that a lot of professionals lack is record keeping. Sometimes when I get patients, I ask them for their medical records and they don't have none. Sometimes they have medical records like patient improved, patient is worse, and that's it. That's all they recorded, all they wrote. And I think it's something that's going to really help us out. It's just a pilot. We still need to try it out and, problem solve. But I do think it's going to be something that's going to save a lot of time for us.
Well said, João. And again, our favorite word in this community is pilot. If you ever want to make me smile, you just
Yeah.
say, I have a pilot that I want you to participate in, and I will already say yes. But I think I'll add, João, to your bit before we move on to some cannabis and cardiac cases, is I am really hopeful to also be able to collect the nuances of a case that falls past sort of our human brain and busy world, skimming records, lots of pages to read, ability to consume. Just biology is so complex, and family unit dynamics are so complex, and the medications, just there's so much going on. I'm really interested in learning how to feed into an AI a case environment and then be able to pull out of that, extract some things that I really want to work on as a practitioner. Hopefully that makes sense. That might just be kind of still in my head thought. Um, but the reason I say that, and we're not going to talk about him today, but my cat, Silas, is struggling with something that I cannot figure out. And so I'm determined, I'm about to feed his case into my AI, and just it's so hard for me to track what's going on because I'm just linked to him as a pet parent. All right, so Dr. Gewehr joins me on the first Tuesday, and we have random conversations. If you want to hear any of our past conversations, you can find them on our podcast. There's a link to that on a slide set that I'll show here in a second that you can find. So today we are piloting, everyone smile with me. We are piloting a new subset of talking about things in the veterinary medical entrepreneur space. And the thing that I really want to work on today, that we're so grateful for you all joining us on, are think tank discussions specifically around a specific case. So we kind of alluded to this already. There's just a lot going on in the world. And I think it would be an amazing idea to bring a lot of the professionals working on a case together in the same space to brainstorm at the same time instead of the pet parent needing to go to see all of us really separately and then us have to read each other's medical notes. I just think there's so much just beauty and resiliency that can come from shared conversations. And so Milo's family and one of his parents is here. Elwood, thank you for joining us today. Is a case that I'm working on that has some interesting pieces to it that I've just brought to the community, and I'd love for us to chat about today. So our goals for today are to pilot some ideas in transparency and medical consultation to let the pet parent be present and engaged and see what comes up. To make veterinary guidance accessible and also digestible, as we see a lot of things shifting in the veterinary world in terms of who can give medical guidance and what that means. I think it becomes more essential, more obligatory on our side to make ourselves more accessible so that we are able to answer questions in emerging markets. Hopefully that makes sense for some of y'all who are working in cannabis space or psychedelic space or just emerging medical spaces in general. And as I mentioned before, community resilience, networked ideas. So thus, welcome to our pilot of think tank discussions. I have put together kind of a case presentation. I have a slide set that I'm going to share. And I've put it together as a practitioner working through a case where I want to solicit some guidance. So it's not necessarily a particularly detailed case presentation, but more the things that I'm chewing on in relation to Milo's case, and I would love some input on. So before we dive into that, we'll do a quick other round of introductions. Because Milo's case is super fascinating, we're going to talk about cannabis, but he's also on a supplement called Myos. And we were, as a community, privileged enough to receive just a presentation and about Myos from our sales rep, our field rep, Andrea. And she let us know that Dr. Patterson has joined the Myos team recently to give specifically veterinary guidance or answer veterinary related questions in regard to the supplement. So, because I was very unfamiliar with Myos, but really am fascinated by the mechanism, I had reached out to Dr. Patterson to ask about concerns about use of Myos in a cardiac case. It didn't seem like there were going to be, but just something that I wasn't sure about and really wanted input and was so grateful to connect. And Dr. Patterson has actually been through our cannabis course. So we've intersected previously. And you also have, Dr. Patterson, I'm pretty sure your own entrepreneurial endeavors. You're on the rehab side. Can you give us a quick intro? I mean, it doesn't have to be quick. We are fascinated. We'd love to know more about you. Tell us about you. Thank you so much for joining us today.
Oh, well, thank you for having me. I do physical rehabilitation medicine,
Mm.
and I have a practice. That's all we do. So like underwater treadmill, exercises. I'm trained in acupuncture. We do laser therapy, pretty much anything to do with rehab. That's what we do. It's we focus a lot on pain management as well. So the cannabis, as it became a bigger thing, it was like, okay, I want to make sure that I can be knowledgeable about this and help people find something. I always joke, well, you can just go to the gas station and pick up cannabis products. Let's make sure we're doing it right. Um, and so I have a background actually in myos as well, or myostatin. Prior to vet school, I was working at Riot Pharmaceuticals studying a myostatin inhibitor for muscular dystrophy. So I was super excited when I learned that the Myos product came out because it was finally like something on the market related to what I had been doing all those years ago. So it was really kind of cool. Um, so I definitely, entrepreneurial wise, I basically run my vet practice, but I've also been very excited to get involved with Myos on a different level to kind of help to educate people and to learn more about it and just kind of for this great product.
Dr. Patterson, I didn't know that. How cool. We're so thrilled that you're joining us today and cannot wait to learn from you. That's such a fascinating history. What a fun intersection that must have been to kind of see that develop as a product. And then did you reach out? Did they see your work? How did you make that connection? And then could
Um,
you give us just a blurb about what your role is there? Kind of what do you do at the Myos group now?
Yeah, and so pretty much as soon as it came out, I was like, oh, I want to learn more about this product. And so I started to know about the research behind it. And so like whenever I had cases, I would, hey, what about this or what about
Mm,
that? So we've been chatting back and forth for a few years. And then they've been kind of just growing as a company. And so they think they have a team of veterinary advisors, and
mhm.
they've been generally the ones answering questions for them, but they kind of wanted to create a position for just a veterinarian who could kind of do that. So the advisors would be more like, I think, higher end, kind of like, how should this company go,
Mm.
kind of thing. So my role is to kind of just answer questions for the staff there, the salespeople, if veterinarians come to them, potentially owners as well, with questions that they don't really have answers to that haven't been asked before, but they
Mhm.
don't feel comfortable voicing, then they'll come to me and ask what I think and kind of go from there. So it's still a relatively new position, so I'm kind of feeling it out and kind of figuring it out. But my goal is to try to kind of say if there's questions and try to bring as much research as I can. Like, what do we know about myostatin, how it works?
Mm.
Because this is a new field, there's not a research in all the things, especially like heart patients. There's not really specific research in myos and cardiac patients. If they've done some research with it and patients that have kidney disease, but not specifically heart disease. So trying to extrapolate what we do know and be safe about it.
That's so fascinating. I'm so proud as a veterinary industry participant of Myos as a company for really investing in your position in saying that that's really important to have that knowledge, that skill set, that research mindedness brought into a new product and making sure that we are safe. I was just thrilled to know that you were a resource and so glad to reach out. And we see so many product companies that are not doing that, that are sort of running with a new option and blowing past the thing where we're putting it into a medical patient and it might not work like we think it should. So I'm just thrilled that Myos is pursuing that track. It was a pleasure to receive Andrea's information, and we do have. I'll link that in the show notes after this because we did have a presentation about Myos from Andrea. So thank you, Dr. Patterson, so much for joining us. I did, but we also have three other guests joining us. So I first want to introduce Tammy. Tammy, you don't have to put yourself too much on the spot, but I'm always so thrilled that you can join us and are part of our community. Do you want to say a quick hello and tell us who you are in our world?
Sure. My role in this whole play is working with Dr. Andre in the veterinary cannabis course. I've been a vet tech for 20 plus years and really got into cannabis in 2019 after I went through cancer for myself and realized the benefit of it as well as for the animals that I've been dealing with for so long. Horses are my first love. That's where I love to be the most. But I do work in a small animal clinic as well. I get the best of both worlds. And I just love, I can never get enough of information about cannabis when it comes to what we can do with it, because there are so many things we can do with it. And I just get excited every time we find something new to add it into. And I'm grateful that I'm part of this community that I get to keep learning.
You're such a treasure, Tammy. You just light up my world every time I get to interact with you. Tammy is also the mentor for our veterinary cannabis certification program. So she helps train all the students who come through our certification program and is also one of the consultants, the veterinary cannabis counselors who support our clinicians. So Dr. Gewehr, if he sees a case, the technician and the veterinary cannabis counselor who's with him can sometimes be Tammy. And we all value when we get to have Tammy on one of our consultations. Thanks, Tammy. Jana, I don't know if you were expecting to do an intro, but we would love to know a quick intro and a quick hi from you. And then Elwood, I'll toss it to you after that, just to give you a little bit of heads up so I don't throw you too much under the bus. Jana, welcome.
Hi, thank you for having me. So my name's it's Jana, but that's okay.
Oh, thank you.
I am a veterinary cannabis counselor. I went through with Dr. Andre for my certification a couple years ago. I'm still getting my footing on the whole cannabis industry and everything like that, working with different doctors and just trying to educate. I'm also teaching a high school after school program for students who want to get into the veterinary industry. And then I also teach an adult RVT program.
Thank you so much for being here. I'm really glad that you're joining us. Elwood, would you like to say a quick hello?
Sure. Thank you so much for letting me listen in. I'm Elwood Hopkins, and I am Milo's dad in Los Angeles. And without taking up too much time, I just wanted to say that we've been working with Dr. Andre since the very beginning of the year, and a few things you said earlier, Dr. Andre, about needing to collect all of those details that fall through our ability to kind of simplify diagnoses and things has really been very life-changing for us and for Milo. So we've really become diligent about documenting all of the things that were happening all at once. And I'm sure you'll talk about it, but it was, began with a cancer diagnosis and advancement in his heart disease and vestibular disease and Horner syndrome, and all of it just piled up very quickly. And the ability to basically look at that in a holistic way has been really helpful to us. So being able to listen in to this conversation is also important for me. Thank you.
Elwood, you are such a pleasure to work with, and your love and dedication to Milo is just outstanding. It's such a pleasure to work with your family, and we're really glad that you're here today. Okay, so we're going to begin talking about Milo's case. And what actually dropped into the chat was one of the first emails that I received from Elwood of a really beautiful summary of kind of what was going on with Milo as he stepped in to our ecosystem. And then okay, so a very quick background because I do want us to focus on discussion about cannabis and cardiac cases for today. That's really our main focus. But I do want to also make sure we're talking about Milo's case. So an 11-year-old male neutered Boston Terrier, about 22 pounds. I first intersected with him in January 2025, and I've kind of listed out here some of the things that you'll see better explained in Elwood's email. But essentially, as Elwood just said, a lot of things going on all at once with this poor kiddo. So he had recently had a prostatic cancer diagnosis. chronic ear infections. And, I really hear from the pet parents' history as we've worked over time that the right side has always been an issue. That as we've begun now working on some rehab and kind of digging into some past history, that I think this has been some chronic right-sided weakness for a long time in this little kiddo's history. And so I began thinking about IVDD. As you see, I put this here, past medical history. Milo is an athlete, and whenever I think about him, I think fearless curiosity is something that springs to mind. He is unafraid to go explore. He is unafraid to do what he wants to, and determined to make sure that the world sort of moves out of his way and lets him move forward. But I think, as we all know, as animals age, that can be a really difficult thing to balance, of helping them learn their own limits, and accept care, accept treatment, and then for us to see kind of what's chronic and what's new and where can we best engage. And as we'll see later, one of the reasons that I think cannabis was really important for this case is because of its holistic nature, because it is working across multi-systems. And as a clinician, I often feel it's sort of a cheat, because if I'm not entirely sure what's going on, if I can support the ECS, if I can really help that body regain balance, even if there's a lot of things that are out of sync or out of whack, or I'm not entirely sure, we can really give the body just an opportunity to begin to stabilize. So December, early January, there was a vestibular event. This was post ear cleaning. And so this has been a thing that now comes up again as we start to see some issues on the left-hand side. Ear cleaning, chronic ear infections, or at least chronic issues in the ear, and some deep medication administration. But the vestibular event wasn't necessarily right after the ear cleaning. There was a little bit of a period of time when I think Emily was doing better, but then we saw a really serious decline. So again, in my mind has always been, yes, we could have had traumatic medication administration, but also just head shaking, so chronic ear infections in a little animal that has like a high cervical IVDD, something like that. Like in my mind, I'm just really thinking about conglomeration of signs here in the upper cervical that from a distance, from a virtual practitioner side, I'm not necessarily going to be able to dig into as much as I want to. So January 25, actually had a diagnosis with a Horner syndrome, significant head tilt, definitely loss of balance. And here's again where I want to bring up the choices that I made as a practitioner to pull in cannabis. Patient was experiencing a lot of incoordination, loss of balance, even with a normal, like, try to shake in the morning, would fall over. And the pet parents really describe a lot of anxiety around not being able to move himself in his own space. So falling over, not knowing why he fell over, just really not being able to engage in the way that was him. And so my background is in a lot of behavioral health. And as I like to tell new clients, mostly I'm a medical problem solver. Virtually there's a limit on what we can do to help, but just being able to pull apart what might be going on is often something that we can be useful for. So when the pet parents bring to me things like, he's just so uncomfortable in his own body, like he's not comfortable moving around, he's very starting to be very clingy, starting to see some separation anxiety, that just tells me that this body is not okay with itself. So whatever that underlying reason is, there is just a lot of imbalance here, and we really need to get this somatic being back into its own body system. And please ask me any questions if anyone has comments there, but I think everyone from that cannabis ECS perspective kind of gets that feeling of there's just a lot going on, and we really need to work on creating some balance and some stability. Okay, so I'm also difficulty chewing was really big in his early history. Gagging, coughing. Pet parents would say, well, he does that anyway. He's a Boston Terrier. I'm not sure if this is normal or abnormal, but we saw some difficulty with tongue movement. We had a voice loss. I think I put that somewhere else. So definitely had a lot of upper head, upper neck issues. Interestingly, we also saw this family was evacuated during the California fires, January 2025. So a very big fire in Los Angeles area, very devastating, loss of a lot of property, some loss of human life, and I actually don't know the animal numbers. But the reason I mention this is because I consider evacuation in a disaster as a diagnosis code in my medical records. The stress of your human family being escalated, not knowing what's going on. Um, uh, Fortunately, the family was able to go back home, didn't lose their home, but just you're not at home for a bit. And so I just think about this little animal's sense of balance in the world, like when your internal system is not doing well and then your external systems are also off balance. I always consider things like evacuation or survival from a disaster as things that need to be included in their medical history. See if there's anything else interesting here. Okay, so the patient is a cardiac patient, and at the time that I met him, had a mild heart murmur when he was last seen by his cardiologist, not currently treated, wasn't determined to be severe enough to be treated. Importantly, the patient had had a previous THC intoxication, and I think this is always interesting for us to talk about. Patient picked up probably a roach, right? So as for everyone's memory, that's just the end of a joint. Someone who's been smoking kind of tosses the end of a joint away. It's in the gutter. A lot of people don't believe that that's a true risk factor for THC intoxication, but it is. We hear about it all the time. And Elwood, can you remind me? I feel like you felt like there was something else besides THC. I think we knew there was a THC diagnosis, but you also felt there was like an amphetamine or something else. Do you have any comments on that you want to throw in?
They did not do any testing beyond
Okay.
THC, and so what the hospital did is they kept him for a day and hydrated him because he
Hmm.
was just having such a hard time.
Yeah.
They were very concerned because his heart rate and so on,
Yeah.
everything was just dropping, and they thought we might lose him. But it cleared up on its own with a lot of hydration, and
Hmm.
so we never really knew what was in it. But it was a very extreme reaction.
Yeah. Yeah. And important, not just for patients' past history. Um, I kind of think about sensitization of the body when it's seen something really dramatic before. I don't think we know that, but I sort of put it in my mind. But then also as we do our certification class, we talk a lot about pet parent goals, pet parent desires can be a big part of how we shape our molecular profile. There can absolutely be situations where the pet parent has had a negative experience themselves with THC, or their animal has gotten intoxicated coming home from a park and they're like, I don't feel comfortable with this. And so this was something that we talked quite carefully about in some of our sessions, cardiac condition as well as past history. And just as a reminder to all of our audience who's listening to our VCCs and upcoming students, um, asking these questions and making sure that you understand which molecules your pet parents are okay with, much less can access, is a really important part of making a clinical protocol. It's not just about what the molecules are supposed to do on paper or in the book. It's how does that actually apply into the family unit and the case itself. Has allergies, has received Cytopoint in the past, some ophthalmic issues that seem pretty stable at the moment. Any questions, anything that anyone wants to ask kind of about that initial case history? Dr. Gewehr?
I would like to know some more details about Milo's intoxication. We don't have a lot of reports about that here in Brazil. I've read an article that stated that states in the US that have legalized marijuana have seen over 300% increase in the intoxication cases, their poison control center. I would like to know about if he wasn't coordinated, if that's okay by you, if you're comfortable talking about it. And also, you said it that his rates were going lower, right? You mean his heart rate and his systolic blood pressure?
Yes. So I what happened is we were walking in on a very busy street that's near nightclubs, and so it should not have been a surprise to me that this happened. He ate something and whenever he eats something that he knows he shouldn't eat, he eats it particularly quickly and aggressively, and sort of grabs it and gets it away from me. And that's what he did. So I knew he had done something wrong and tried to get it out of his mouth. But I would say within about 30 minutes, we were back home, and he had a real loss of coordination. And because he was accustomed to jumping on and off a couch, um, it seemed very severe. Almost, I mean, not like a seizure exactly, but it was more than just a slight wobbliness. He seemed to really be struggling with very strange motions and getting more anxious, which made the motions even worse. So I actually thought it might have been a seizure and took him to a veterinarian's office. They said, there's nothing we can do here. You have to get him to a hospital. His blood pressure, breathing, everything seems to be just dropping way down low. And so from there, it was an emergency room and it was during COVID. So I didn't have a lot of opportunity to ask some of the more detailed questions that you're asking, and was just relieved to get a call the following morning when they said that all of a sudden, after sort of lying in a really out of it state and being hydrated, they said he perked up like a light switch. He just became alert and funny and normal. And it was quite sudden, according to them, at about 4 in the morning.
I see. Thank you. Thank you for that. You mentioned, Dr. Andre mentioned you had a suspicion about having other substances, maybe amphetamines or something like that.
This was less anything that I was recognizing in his behavior and more a warning from the doctors I spoke to that because of where he had been walking, their experience was that a lot of the things that get picked up, that they really wanted to be sure that it wasn't something that he had gotten at home, and that they were kind of hoping it was so that they could be 100% sure what it was that he had consumed. But because of the area we were in and the incidence of reports that they were receiving of dogs having, not making it, it was more that they planted a suspicion or a question in my mind about whether there was something else in it.
Okay, thank you. Thank you for that. I'm glad Milo's okay. Definitely, at least from my understanding, if he gotten some amphetamines or something similar, I think would be more severe. At least it would be more severe. I don't know exactly the symptoms. I guess it depends on the amphetamines. That's not exactly my area of expertise, but it looks like a classic THC
THC
intoxication.
response. Okay.
Yeah, it
Thank
looks like it. Yeah, the incoordination, the being more lethargic. He was not exactly wobbly. He was definitely like more incoordinated. That's definitely something that we can see it happening. But I'm glad he's okay. The article states that it is something that's happening more often. It is something that happens very frequently, but very rarely we have animals dying because of it. Of course, most articles are stating that for healthy animals. That's the questions that we need to answer, and that's probably what Dr. Andre is going to say in her presentation, is that for healthy animals, it is very safe, even when they're intoxicated. But we don't have exact answers when the animal has heart problems, kidney problems, or some other issues that might be worsened by the THC. And just one final thought is a problem that at least US residents have stated is from synthetic cannabinoids. So sometimes it's not exactly the THC intoxication, is a synthetic cannabinoid which can be more harmful. It can be actually more potent in the CB1 receptor, in the brain receptor, so that can be more troublesome. Thank you for that, Elwood.
Thank you.
Please go ahead, Dr. Andre.
Any other questions or comments? I'm going to move to just chatting about using cannabis in this kiddo. Okay, amazing. So let's see. So I put two links in the chat. And this is the product that we did start. So that's kind of VetCS is a local company out of Colorado. Dr. Lukey and Trish do an amazing job with their product. I trust them for safety. So at Veterinary Cannabis is a product neutral company, but knowing the products that are doing a great job and are keeping their products safe is something that we think is also really important. But we also use products that have COAs. So I've also linked the COA there. Okay, I'm going to share my screen again, and there's not a lot on this slide because I want us to mostly look at COA, but just to mention, so we did start cannabis in this patient, and I did a lot of brain racking, thinking about, do we want to try a product that is maybe a CBD isolate or broad spectrum? So broad spectrum is the term in the cannabis world for no THC. That's just very much jargon. It doesn't make any sense, but you just kind of have to know that if you're navigating the cannabis world. So those are options that we have to pull out THC entirely, to maybe only use a CBD molecule or some isolate molecules. So as with the pet parents family, we had several discussions actually speaking about, using a complex spectrum. So that's what I would call this product. It has multiple molecules. It has a really nice background profile of molecules, but with the CBD molecule being the most dominant. So the highest amount, the highest concentration, but it does have some THC. So the reason I like this product is because it is safe. I trust VetCS to not have extra pesticides, heavy metals. So when we're dealing with the unknown, we do not want anything extra in the mix. Keeping it as simple, plain, and as clean as possible is really good. But we also don't understand what's going on. And so having a really wide spread of background molecules that can support body processes that are not quite sure what they're supposed to do. And also we really think about the CB1 receptor, so in the central nervous system, but really in the central nervous system where we see its effect, as we've just talked about from THC intoxication. CB1 being really important here, but also CB2, so in that peripheral immune system, somatic, body, musculoskeletal, GI system, all of that really, I think this in this little animal needs a lot of support. So the CBD molecule crosses nicely between both, but is really supportive of the body. All these background molecules and terpenes are also going to support the body side. And importantly, I think that the use of THC is important in this case because we have things like vertigo, some nausea, incoordination, separation anxiety, definitely musculoskeletal tension, like a lot of tension in his neck and upper cervical. So without this being a cardiac case, this would absolutely be my product of choice. Hands down, no question. And particularly having THC in the mix to let those neurons begin to coordinate and speak and wire together and help that body reestablish its balance. But the question is, in a cardiac case, what are the risks and what are the pros? What are the benefits that we might see? So when we speak about this, I'm going to move to talking about cannabis specifically. So let's grab anything else that we want to from here. 2 drops BID, rescue dose. Does that make sense to everyone? I gave the pet parents instructions that if he's mostly separation anxiety, if he's really struggling, if he's really tight, if he's kind of doing some shaking and trembling, he can have a rescue dose. And usually for me, this is just a repeat of one of their doses at the pet parent's discretion when you feel like his body's just really struggling. So that was his starting. We also began to talk about traction and proprioception from paw friction, which is another amazing product, booties, rugs, raising food bowls, massage, kind of making sure those nerves are waking up. Began to seek in-person practitioner. And so we're going to do cardiac case, and then we're going to talk about myos. So I'm going to unshare the screen, but let me know if anyone wants to see that again. Okay. So when we think about caution in cannabis use in cardiac patients, the reason we all cite is increased heart rate, increased changes in blood pressure, changes in heart rate, and usually increased. And the reason this is concerning in a cardiac patient is because it's putting stress on that organ that we already know is problematic in ways that we can't exactly control, right? We're just going to give a substance and it's going to change the heart rate. But here's the important thing about cannabis. This is also psychoactive, especially if you're using THC. And so the anxiety component of being intoxicated is a huge thing to consider, as well as just the physiologic effects of the molecule itself. So THC in and of itself may change heart rate, but a little animal who doesn't know what it got and is stoned and lights are bright and noises are loud, that's more problematic I think, for the cardiac system, probably than the molecule itself. And we do have evidence, and I'll toss it to Dr. Gewehr in a moment, we do have evidence that cannabinoids are cardioprotective in some cases. So when I think about this case, I really want THC for the coordination, the rebalancing perspective, but I also want to get this animal out of his vertigo, out of his falling over when he tries to shake, because my clinical suspicion is that that is more distressing for him and more likely to elevate his heart rate of being anxious, panting, looking for where his dad is, nervous because he's falling over. I feel like that is worse on his cardiac condition than the application of THC. So we did start him on this product, and spoiler alert, he did really well on it, and pet parents feel that was, really impactful in his improvement. But guys, we don't know that that's okay. We don't know that that's a good choice, and we as our community, we say, be careful, be careful. So for all of our students who've heard me say that in class, I thought it was a really great opportunity for us to talk about what's the difference between contraindication and caution, and really looking at that entire clinical picture and kind of going from there. So, Dr. Gewehr, you had a chance to kind of look at some really old articles about why we have that concern about THC. Do you want to give a quick, just general update about why we think there might need to be caution here?
Yeah, we have some old articles about THC. I want to bring up some new articles about CBD. But first of all, we got to keep in mind that cannabis, it's not a single thing. We are talking about a number of molecules which may have different dosing in different ratios in different animals. So when we talk about pharmacology, we are talking about how these molecules are going to interact with unique patients, because every patient is going to have a reaction of it. And of course, we have predominant reactions on different dosages. We have probabilities, let's just say like that. But it's something that's very complex. So we cannot provide a single answer for an issue. And also, we have a lot of questions that we still need to answer, right? I'm going to steal a phrase from Dr. Andre. When I was in the US, remember you said, work researching cannabis because you'll have work for a lifetime. I say in my classes here in Brazil that we have centuries of research to do about cannabis. Because in here we can talk about THC, we can talk about CBD, we can talk about different ratios of the molecules. But what we do know right now is the extremes. Let's just say like that. Like we do know about a CBD isolate, so we know exactly what's on this spectrum, and we know about the THC intoxication. So a very high dose of THC on the other end of the spectrum, but between both of them, we have very different ratios. When I'm talking about a product that is 25 to 1 CBD THC, so we have 25 times the concentration of CBD 10 THC, it is one product, it is one pharmacology. When we talk about a product that is a one-to-one, that's a completely different thing, and so it's very complex. When we're talking about THC, we can see changes in the heart rate and blood pressure. Mainly, what I remember from articles is hypotension. So we can see a decrease in the blood pressure, and we can see changes in the heart rate, both coming up or down. That's from intoxicated patients, so that's not in a clinical setting. I've never seen any clinical trial of heart changes in animals. In my research, we haven't used a lot of THC. I'll bring that up in a minute when I talk about CBD. But that's the main concern about patients that have heart problems. If you have a heart issue and we change the heart rate, that may predispose of an arrhythmia. Maybe if we provide an hypotension of the patient, we can actually, in one case, if the patient has an hypertension, if he has an increased blood pressure, if we reduce that, that might be good for the patient. That's actually one of the goals of the treatment. But the thing is, we don't know if that's beneficial with the THC. We need to be cautious. That's the main thing. It could be beneficial, but in this case, we are talking about an intoxication. We don't know if that's helpful. And if we provide too much THC, we have other side effects, or we may reduce the blood pressure in a manner that's too bad for the patient. We can reduce too much of the blood pressure, and that can be harmful for the heart. So we don't have exact answers, and that's the main problem. So we need to be cautious. I would be lying to you if I said that I never worried about that, because we do get a lot of patients that have heart issues or kidney issues, because most of our patients are older. Most of the conditions that we treat are in older patients, like musculoskeletal conditions. So I did had some concerns in the past. As a VCC, I also completed the course. I've always been careful about the THC in those patients, and I always requested regular exams for those patients. I always explain that to the pet parents, and I requested more frequent exams. I've never had issues with those patients. I've never changed doses of other medications. I don't think I was ever knowledgeable enough. I'm not a cardiologist for me to do that. I usually work with the specialists. I've never seen any changes in exams after we started the product, but that's something that we need to be careful of. Also, I'm kind of annoying with articles. I like to have my professional approach based on articles. It's not about my personal experience because, that's a very tiny population that I'm evaluating compared to an article that maybe evaluate like 30 patients, 50 patients, 100 patients, all in one setting, all standardized. So in my experience, I never had problems, but I always have been careful about it. I never given too much THC to a patient that has heart issues because of those concerns. About CBD, and that's the more recent articles, they have seen it's not changes in the heart rate, it's more about they haven't seen the changes on which other patients who were not receiving cannabis had. So, in my research, and that's actually supported by some research in mice and in humans, animals who are stressed, they have a tendency of increased heart rate. And when those patients, or at least like in similar conditions, and when given CBD, they don't have so many changes or such. They don't have the same changes in heart rate. They don't have an increased heart rate, such as animals who are not receiving CBD. I don't know if I'm making myself clear. I can send you the articles if you want. But basically, in my research, we had a control group. The control group only received olive oil, which was the vehicle for the cannabis product that we were using. We had a group that received 2 milligrams of phytocannabinoids, and we had a third group that received 6 milligrams of phytocannabinoids. The product that we were using was a 21 to 1 CBD THC, so very heavy on the CBD side, not so much on the THC, and it had a lot of CBDA. So it was mainly CBD and CBDA and a tiny bit of THC. And we were evaluating mainly the propofol dose. But before we anesthetized the patient, we did a number of evaluations to see if the animals were sedated, to see their heart rate or their blood rate or their blood pressure. And what we saw was that the control group had increased heart rate compared to the groups that were receiving CBD. So we were seeing that actually CBD reduced the oscillation or the changes in the heart rate, which was where Dr. Andre was mentioning about maybe being cardioprotective in a way that it doesn't change so much.
Fantastic. Love it. Great summary. Really great grounding in some of the literature that's out there. Any questions or comments? Then we're going to talk about fortitropin, kind of things going into this case. Well done. Thank you, Dr. Gewehr. Okay, so we started cannabis on this product, and we'll talk about kind of outcome in a quick moment. But I also want to give Dr. Patterson a moment to speak about some of the questions I asked her about using fortitropin in a cardiac patient. So again, for me, this was new supplement that I wasn't super familiar with, that I understood the mechanism from a brief presentation. I'm really interested in it from a musculoskeletal injury recovery perspective. Patient is older. I think that there's a lot that his body just needs from a recovery perspective, and think it will be really useful to try for his particular case. So Dr. Patterson, I had passed you a couple of questions about Milo's case, just about what do we know about cardiac patients? Do you want to give us kind of a quick overview of what we know so far and kind of what you contributed to the case?
Yeah, so myos hasn't been studied in cardiac patients specifically, but we do know that that it's myostatin is something that is just kind of lives is part of the natural body, and there are naturally occurring myostatin deficient animals, so animals that don't have any myostatin in their body at all. One like naturally occurring one is like a cattle, it's called the double muscle cattle. And so they do look like these like super beefy cattle, which is kind of interesting. But their cardiac function is completely normal. They've also done some studies using like transgenic mice and chickens and things like that, and again have huge amounts of over muscling is what they call it. And they also have normal cardiac function. So that's really encouraging to me. That the myostatin inhibitors like fortotropin shouldn't have much clinical effect on the cardiac function. And that is kind of shown too. I don't think that anything has shown that it has decreased cardiac function in any way. The reason we kind of worry about it is that myostatin can help to promote muscle breakdown. So we're inhibiting it to increase muscle, to promote muscle growth or to prevent that breakdown. And so we worry that if we're inhibiting it, are we going to create too much muscle? So if you have a kind of like cardiac patients that have too much heart muscle, like hypertrophic cardiomyopathy, are we going to make that worse because they already have too much muscle? What I had kind of said in this case, it was more of a case of DCM, which is dilated cardiomyopathy, which where the walls tend to be thinner and they don't effectively don't have enough muscle to kind of pump things effectively. So in this case, you could make the argument that it might make it better. But again, we have no studies to kind of show that. But I didn't feel like it would in any way be harmful, based on the fact that, all these naturally occurring animals have completely normal cardiac function. And all the studies so far, like none in people and in animals, is never shown to cause a problem for their cardiac function.
Thank you so much for that, Dr. Patterson. It's so fascinating to kind of just think about those potential extrapolations, like what we sort of know and what we're kind of thinking about. What are your perspectives from that rehab side? Maybe less about the fortotropin itself, but just somatic health and the patient being able to move well and muscle beginning to repair. Do you have any thoughts on that kind of in the patient's long-term health goals?
Yeah, I mean, certainly we see a lot of older patients that have decreased muscle mass. It happens in people, it happens in animals, and then they can't do the normal life activities, and just, it becomes hard to just stand up and kind of walk around, and their muscles start to shake more, which is a lot of times what we see. Owners will come in and say, "Oh, the patient's muscles are kind of shaking," and it's just because they're weaker. They don't have that strength in them. So I think that's where myostatin can be really helpful as well. Again, maybe we're not going to become like super bulky animals. We're not expecting that, but we're expecting them to have better muscle function, not to kind of have this breakdown in muscles that normally happens. And normally it'll break down and the body kind of repairs it, but that whole mechanism kind of just doesn't work as well as we get older. So I think we're preventing that kind of muscle breakdown and kind of helping to make it stronger. So I think that's for me where myostatin can be really beneficial overall. And the truth with cardiac patients and more severe cardiac patients will have cardiac cachexia, so they'll have muscle wasting as part of the cardiac process. So this could potentially kind of help that as well. So
do you feel like that could prevent that or like stave off that process, or that's just too much of an extrapolation there, Dr. Patterson?
yeah, I mean, I think we have it. It's hard to say because it again
Yeah.
hasn't been really studied. I think that it's the same thing that we know. Like if we know that a dog had a surgical procedure and they're going to probably lose muscle mass as part of the recovery phase, because they're not doing as much and because all the functions of the joint have changed because we did surgery on it, and we know that myostatin inhibitors like fortotropin can help to prevent that muscle atrophy. So I think, and for the cardiac cases, yeah, there's a good argument that hopefully, again, you'd have to probably get on early enough because, before you had too much cachexia and muscle wasting kind of going on. But I think it could be protective in that benefit. But again, we don't have any studies to kind of show that. And that would be a longer term study than just like had a surgery and kind of trying to recover. So
yeah. But I hear from your side that probably the supplement will be positive for Milo throughout the rest of his life, just a good kind of solid support in the
yeah, I mean, I
background.
think, again, combination getting older, I think it would be very beneficial. They're going to have prevent problems at the same time as, yeah, with his heart issues, even if they're pretty mild, like to start off with, we can kind of hopefully maybe, I don't know, it's maybe too much to say it'll make the heart better, but it shouldn't make it worse. And maybe help to forestall some of those muscle problems that might come up if the heart does get worse.
Yeah. I just as a quick detour, we had a question from our community when we knew that we were going to be chatting with you that I'm going to put in the chat, speaking about use in younger animals. I think we see this, or at least I do, in a lot of the sporting community in uh, young, maybe not puppies, but like beginning to train, like young adolescent. Um, and I think I hear people say, well, why not? It can't hurt anything. And that might be true, but I think from what I understand about the mechanism, it shouldn't actually have any effect because the animal ha doesn't need that. Can you elaborate a little bit on like a young animal use?
Yeah, I
Is that
mean,
negative? Should
I think it,
does that do?
yeah, I mean, I think it could help. I mean, if you look at myostatin and how it's marketed in people, it's definitely used for like you're trying to exercise, you're trying to build that muscle, and it's
Hmm.
not necessarily as much as an older, the geriatric population. So I think again, I don't think that it's just I think it could be beneficial. I think if you're going
Hmm.
to prevent some of that muscle breakdown that normally happens, you're going to help it to build better.
Hmm.
I think you might not see as much of a huge benefit. I think again, the studies so far seem to be showing more to help with muscle atrophy.
Hmm.
I don't see certainly no harm in having younger patients do it. If you have a completely healthy younger patient and you're trying to like condition them to do better, I don't know that if it's going to make a huge difference, but I don't think it would hurt. It, and I think if anything, it can help it to kind of the muscle to function better.
Hmm.
So
Fascinating. Love that.
if you're looking for that like competitive edge, I think it wouldn't be a bad idea to do it.
Uh-huh.
But
Is there a
I
too
don't,
young,
I
is there a
haven't,
too
I don't
young
usually recommend
animal
it.
that you would?
No,
Okay.
I don't think there's any reason you couldn't give it in younger animals either, in like puppies and things like that. I mean, usually
Hmm.
I don't, but we definitely have had patients that are like 6 months old and they have fractures and they have to, we don't want to have them lose that muscle mass and
Hmm.
things. So I think there's no
Hmm.
contraindication for it. Um,
Yeah.
and that would be cases I'd probably more likely reach for it.
Yeah, I definitely agree with that injury in a young animal. Just like on the cannabis side, um, from the cannabis side, we think a lot about caution in using it in young animals simply because there's a developmental process happening that we want to be really
Yeah.
respectful of. And by just changing it, putting something in the middle, you have sort of changed that development over time. But if there's a seizure in a young patient, injury in a young patient, yes, absolutely supporting it there. So in my mind, it seems very similar to that, but I definitely have cautions on the cannabis side in young animals. And I guess my sort of basic clinical instinct is, unless there's a reason, don't interrupt what's going well. Would you say that that's kind of a generally useful clinical
Yeah.
picture? Okay.
Yeah, I think that's a good way to kind of put it. Like, I wouldn't just say, oh, I want this dog to be a great agility champion. I'm going to start him on Myos at 6 months of age in hopes that
Uh-huh.
they'll have more muscles. I don't think there's a great argument for that. So,
Uh-huh. But if they had an injury for sure to help them recover. Yeah, I definitely support that.
yeah, to kind of
Yeah.
help them recover and kind of prevent those problems, certainly. Yeah.
Yeah. Um, Great question. Yes, Dr. Gray. Great discussion.
Look, actually, I have a question. I didn't quite understand the mechanism. I don't think I ever saw that supplement here in Brazil, so it's very unknown to me. And I'm sorry, I don't think I quite get that. How does it work
Yeah.
exactly? Do they have
So,
like the muscular mechanism of it?
yeah, so normally myostatin promotes muscle breakdown. And so when you're inhibiting the myostatin, that the corticotropin is supposed to do, and you inhibit the myostatin, then you're preventing that muscle breakdown. And got discovered basically because they found that those naturally occurring animals that don't have any myostatin had way too much muscle. Skeletal muscle particularly is what it affects. So the idea was, can we help improve, like I said, when I was originally studying it, it was for muscular dystrophy. So can we help to create more healthy muscle in those patients? And again, I was really early in the studies and that, so I'm not even sure what ended up happening with it. But I know there have been some studies, but then I don't think that it showed that improved that there. And in animals and in people, they have shown that you give the fortotropin myostatin inhibitor, it does help to affect the myostatin levels. Not all the studies show that, but I think it's a supplement that has to be given kind of long term to see the benefit. So if you give myostatin, I don't think you're going to see a benefit in changes in serum levels or a benefit within like 3 days. It's not going to be like instantaneous because that's not really how muscle works and muscle building works. If you think of it, it's like a process over time. So in that sense, so yeah, so it's basically inhibiting the naturally occurring molecule that helps to break down muscle.
I see. I see. Actually, I remember. I think Dr. Andre actually put in the chat. It was your wiki, the double muscle cattle. Yeah, I know about
Yeah.
the double muscle. I remember that from college because when we studied like breeds of bovines, and I remember
Mhm.
like Belgian blue. I think was the main
Yep.
example that they said. I'm not really
Yep.
from that area, like big animals, but I remember those bulky bulls that they have.
Yeah.
Um, so I remember about he was talking about I don't know if I'm pronouncing that right, myostatin. But that's very interesting. And actually talking about heart situations and heart issues, one thing that can actually predispose heart problems. Of course, we have genetic problems, but we do have people and animals who don't exercise. And just like you were saying, maybe you don't actually help prevent a heart issue, but you actually you help through other mechanism actually. Like if you can actually provide muscle, or if you slow down muscle breakdown, if the animal can exercise better, that's better for the heart. So it maybe helps directly depending on the heart issue that we're talking about, like we are saying about the dilated cardiopathy or the you say like concentric. I don't know if I'm saying that right, but maybe like indirectly. But that's very interesting. I don't think I ever saw that in Brazil. I don't think we have that.
Yes, we learned from Andrea that they are not yet international, but are working hard to make sure that they can become so. So that'll be exciting whenever that becomes possible. I'll just quickly mention also a caution that we've heard from Myos and Stephanie, if you want to elaborate on, is chicken allergy. So this comes from fertilized chicken eggs, and they have seen that chicken allergies that can carry through. That's of interest to me because my cat has a chicken allergy and I would really like to use a supplement on him. Stephanie, do you want to add anything just quickly about that
Yeah.
piece?
I think the biggest concern is more like egg allergy because it is
Mm,
chicken from eggs. I don't know how, and I guess to be honest, then I'd have to look and ask them more about that to be honest,
mm,
see how much that they had as far as with chicken allergy. I think it's a much bigger concern if they have a known egg allergy. I'm not sure
mm.
that it's as big a concern for the chicken allergy, to be
Okay,
honest with you, but I'd
great.
have
That's
to
good to
double check
know.
on that for you.
I would love to know that answer because I would love to use it in my kiddo with
Yeah.
less concern. Tammy, what's your comment?
Okay.
My understanding from the allergy side of it is that the egg is completely different from the chicken,
That's
and
what, yeah.
generally they don't cross-react.
Okay.
So that I mean, from dermatology, that's the way we look at it. I mean, we would stay away from it from the start if we're dealing with a patient with
Hmm.
chicken allergies, but then that is an option to add back in because they don't cross-react. It's
That's
not the
so good to
same
know.
DNA. The egg and the chicken is not the same DNA. That's my understanding.
Tammy, you're such a star. Thank you for being here today. Yeah, that's super interesting because that's been a question. I just want to use it in my kiddo. Aging cat, hind leg muscle atrophy. Like I'd love to use it in his case, but chicken allergies is a problem. So, okay, maybe I will with slightly bated breath add it into his protocol soon. Steph, anything else to add or any other comments from the community?
No, it's just great to be a part of this discussion.
Yeah, so much fun. This is fantastic. Okay, so I'm going to move us on because we have about 20 minutes left and I want to get to a few other pieces of this as my kitty struggles here with me. Okay, just a moment. Okay, so the pet parents were willing to go and get a baseline, sort of a new baseline check-in, just recheck in with the cardiologist, and we're willing to specifically pass them some questions. And we asked intentionally, what do you think about cannabis use? And I'll pull on Dr. Gewehr's comment of we're looking for volume. So while this is caution in our cannabis general world and our education, we speak about contraindications and cautions. We really lean on specialists in all the different fields to see the volume, see the number of, well, one time it happened. Well, where was this one case where, like, that's really what's so about, in addition to the extra education, just seeing those cases over and over. So we did pass that question forward, also asked about Fortitropin. Cardiologist had no concerns. The patient was started on pimobendan, so the cardiac condition had progressed, but the cardiologist was not concerned about the use of cannabis. I do just want to mention that the notes say okay to continue CBD. use. And so we've just had a full discussion about that's not entirely the question that we asked. And so it does make me slightly concerned that maybe this is being answered from not the full perspective of what about also THC? What about also this mix of molecules? And Dr. Gewehr, as you mentioned, it's one pharmacology. I really liked how you said that of yes, individual, but when they're together and inpatient, you really have to think about it as that whole. But in general, we have the sign off from the cardiologist that this should not be negative for the patient. Worked with a pet parent to kind of be able to count resting respiratory rates, but talk about what exercise fatigue or intolerance might look like so they can watch out for progression of cardiac signs. From the cannabis side, my plan is to keep him on the cannabis product because of some of the other things we see developing and how much it helps from a behavioral, improved separation anxiety perspective. But have spoke with the pet parents if we could rearrange molecules. I think that it's possible to probably convey the benefit that he's receiving with a little bit heavier CBDA, a little bit heavier CBG, maybe some beta caryophyllene, and be able to pull out the THC. So I do think we could achieve support without the THC, but when we passed this to Dr. Gewehr as a medical director and as community, I talked to a lot of people about this and spoke with the pet parents. We decided to keep him on the product because he is doing so well. And a point that Dr. Gewehr brought up in this particular case is sometimes the patient can do worse when that support is pulled away. And again, I think that this product has been really supportive in his case entirety. It made a significant impact in his immediate improvement. Pet parents feel that it really allows him to be less stressed, be better in his body. So he's responded really well to it. And so the now concern is, well, if he doesn't have that, could we see recurrence of signs? Could we have more separation anxiety, increased heart rate? So now it's more he's doing well. We have a new baseline. We kind of know our marker. We have a 6-month check-in with the cardiologist to say, have we seen changes that are negative? If so, we need to make a switch. But at the moment, the plan is just to keep him on this product. Comments or any questions there? Anything to add? Okay. And then I will say that his neighbors and friends say that he's looking very buff on his Fortitropin supplement, right, Elwood? That everyone comments about just how good he looks, how well he's doing. Do you want to comment on that?
Yeah, that's what I was going to interject that on the last question because what we've seen in Milo, and again, it's hard to disaggregate the Milos from the fact that it also allowed us to resume some physical training and some leg exercises. But what it is clear that it's done more than just slow muscle atrophy. People comment on him, they'll say, "What a fit-looking dog!" And so, without having any insight into the list of health problems he's dealing with, they think he's this rough and tumble little puppy. And so just as one anecdote, I wanted to give that feedback for the Miles. He looks very toned.
Yeah. Yeah. I mean, what a great thing to say about senior animal. Wouldn't we all love to be able to say like they have that life and vigor in them? That's beautiful. Dr. Gewehr, comment? Did I see anyone with a hand? Anything to add?
Yeah, actually, you were talking about product variability. But before that, do they have that product for humans? For like gym people? If I'm working out, I wanna take some of that.
We call it Milo's pre-workout supplement.
Yeah.
Pre-workout?
And
Yeah.
Well, I'm ready to try it myself.
and
Yeah,
people,
let's see if it helps me.
yeah, in people, it's called yoked. Like if you look it
What's
up,
the name? I'm
yoked.
sorry.
Yeah, so you can get it as a supplement for
I gotta look
humans.
that up.
Yeah,
I'll find it.
Yoked.
yoked. Yeah.
Send me the link, Dr. Andrew,
Yeah,
please.
I got it. I got it.
Yeah, that's very interesting, and that's actually really nice because when you see like musculoskeletal issues, having more muscle is actually bringing more stability to the joints. So, I mean, talking with Tammy, who works with rehab, Dr. Patterson also, you know that better than me. So, if you have like this really good muscle tone, you have more stability, so you have like better joints, you have better exercise, you have like better heart health. But you were mentioning before, Dr. Andre, I don't know if I'm missing it out, but you mentioned about the variability of the products, and it's just for now, at least the answers that we have. It is be cautious, be careful about dosing, and keep rechecking, I guess. Keep doing exams. One thing that I want to bring up, you mentioned about the reevaluation with the cardiologist in like 6 months and seeing if the condition progressed. One thing that we got to keep in mind is that this kind of condition progresses, right? It is something that's degenerative. It is something that gets worse with time. So we need to see if, and that's the tricky part, especially about research. Uh, is is it worse? Okay, but is it worse because of the CBD? Is it worse because of the condition itself? Or maybe the condition would be worse if we were not giving CBD? So those are some three questions, and it's very hard for us to tell because we don't know what would have happened if we did not use or if we did use some other thing. So that's why research is important. That's why we need to have multiple patients. We need to have a control group on which the patients are not receiving the substance or the medication or the supplement, and patients who are receiving it, and comparing both of them because biology is hard. We like to say that in Portuguese that diseases do not read books. Sometimes we expect a few things and they are not so real when it comes to our practice. But it's very nice to know that he's okay and that he's actually like how did you say he's very bulk? I forgot the term
Bulked
that you
up,
used.
robust. I don't remember what I said either. But he's
Bulked
joined
up?
us. Welcome, Milo. Thanks for showing up
Yeah,
and saying
yeah.
hi. Hi,
Hey,
kiddo.
Milo. And it's
Um,
that's very nice to hear about a senior patient because a lot of them, when we get to the appointment, we can see that they have a lot of muscle loss. They do have a lot of stability, just like Dr. Patterson said about the patient who's kind of like shaky when they stand up, when they walk. We see that a lot, especially on senior patients. Oh, we have
we have
another
Boston
member.
Terrier
I gotta
Day.
get mine. Sorry. Yeah. I don't think I ever see a caramel Boston Terrier. Only the black ones. But summary about the cardiac issues and CBD, I guess that's it. Be careful about the THC. Check blood pressure regularly. Maybe do echocardiograms regularly. Follow up with a cardiologist. I always like to work with specialists and keep in mind about these changes and see if we are not worsening the problem or the condition that the patient already has.
Amazing. Beautiful. And I love the Boston Terrier Day. This is incredible. Okay,
Yeah.
quick share screen back here. Okay, so uh, pet parents now have an amazing trainer, have had an amazing trainer, but the trainer is now beginning to work with them on rehab exercises, and Milo is a star. And we've seen really steady improvement in his ability to navigate stairs. Pet parents have rugs now because Milo is not into boots or having little rubber glued onto his feet. So rugs are now installed in the house. And pet parents feel that he has done really well in his just trajectory of improvement. They also have an animal massage therapist who's done a lot of work with him. But I've really just encouraged pet parents to continue to seek an in-person integrative care practitioner. I just don't feel like we fully understand the root cause of what happened. IVDD is still just big on my list. And I think that he needs some hands-on body work care and some acupuncture would be amazing. Like just he needs that set of modalities that has been really surprisingly difficult to find. But we have recently connected them with an individual, and we're hopeful that will work out. Just a couple of successes. He had lost his voice over some of this incident, and that was so sad. And it made my heart so happy the first time the pet parents told me that he was talking again, that he had got his voice back, yawning, playing with toys, bringing toys, just being willing to interact. And mostly their comments were his spirit is more like himself, that he feels more confident in his ability to navigate. Even as he still had a little bit of balance loss in that recovery period, he felt less worried about not having his balance. And I think that that for sure was the piece that I was looking for in cannabis use of helping those nerves speak well to each other, but also the patient to be less concerned about something that wasn't working. And I think that in my mind, that definitely is positive for his cardiac condition. Okay, so just a few minutes left. So the patient has started to experience signs on his left side. So he was recently seen at his primary care for a left ear issue and swollen ear, but I believe the cytology was actually negative. They have started him on Claro again. But what I want to ask the group is, well, again, we are seeking in-person integrative modality support, some of that. And so I think that's really where our true answer lies, is to kind of see what's going on in that upper neck. But here's my question that I really want to talk about before we close. What does everyone think about topical cannabis use in the left ear? So I'm concerned about changing his dose. Despite everything we've talked about today, I don't want to go up. I think that that would be unwise. I'm happy staying where he is. I think he's doing really well on it, but I think that increasing cannabis dose would just not be positive and for all the things that we don't know. But I'm curious what everyone thinks about in ear, so topical use, if that would be helpful for some of the swelling. And really what's concerning in my mind is whatever the cause is, until we can get that in-person support, just head shaking is not good, loss of balance, not good. And particularly as he starts to lose hearing, he is starting to show separation anxiety signs and just really struggle with, he doesn't know where he is in space. So there's just some pieces that I think we need to tweak here. Tammy, what's your comment?
Well, you know I love topicals, so
Yes, I do. And I
being in
will hear
dermatology, and
exactly
we
what
see
you want to say.
we see a ton of ears. Yeah, I would absolutely, especially because if cytology was negative, did they say if the tympanic membrane was intact or
I
not?
think they couldn't
And
see
I
it.
don't
I
know
think
if it
it
would
was so
necessarily,
swollen that they
they couldn't
couldn't
see
see.
it.
Yeah.
Okay. I don't know if it would necessarily matter with cannabis.
I don't know.
But yeah, I wouldn't have a concern of it. And mostly because even if you look at all the topical ear medications that we use, they usually stay within the ear, even if the tympanic membrane has been
Mm-hmm.
um,
Ruptured.
torn.
Mm-hmm.
They're not ruptured. They're not an issue with being moved systemically through the body. So it's not like you're adding more into the body.
Right, right.
I see no reason why not to, and especially if cytology was negative and you're looking at just the inflammation, absolutely.
Well, I see that Dr. Pattison has to jump off. Oh, I didn't catch her before she left. Dr. Pattison, thank you. We're so grateful that you were here. Thanks for joining us. Tammy, that's an amazing comment. And that's exactly kind of where my head is of it's not going to go systemic. And so it avoids my concerns of extra dosing there. But just from that inflammation perspective, it just feels really potential. Dr. Gewehr?
Yeah, I'm definitely advocate for the topical use. My main concern would be about the vehicle of the product that we're using. I
Mm-hmm.
don't know exactly which vehicles are used more often in like ear products, like specific ear products. But my main concern would be kind of vehicles that may be irritating for the skin or that may be a little unusual, let's just say like that. I just think it depends on the vehicle that the CBD or the phytocannabinoids are diluted. I think that'll be my main concern. We do have cannabinoid receptors in the skin,
Mm-hmm.
and we do see an increased receptors in inflammation. So we can believe that if the skin is inflamed or the ear is inflamed, most likely we'll have more receptors in that area. My main concern will be about the vehicle that the cannabis is diluted.
I think that's a great point to bring up, especially if, well, I'll say that, but then I'll sort of contradict myself. The first thought was, especially if there was a positive cytology, like keeping the ear too moist if it was an oil, something like that springs up. But then we also see a lot of antimicrobial properties in there. And Tammy's shaking her head that it would probably be more beneficial than harmful in that case. I don't see offhand what the VetCS product is made in, but I think they're a hemp-based, like a hemp seed oil, but I will look into that because it should be on here to find. So I think either an MCT oil or a hemp seed oil would be great or not problematic, right? Would y'all both agree for that?
Yeah, we tend to use, like, even when we're getting products compounded for the ears, we will tend to
Hmm.
use an oil emulsion. I can find out from the compounding company exactly what they use, but it is an
Mhm.
oil-based product because it
Okay.
lasts longer. The water-based products, they have a real short lifespan on them. And
Mm,
if we're having to treat an ear for 2, 3, 4 weeks at a time, if it's a chronic condition, we tend to use the oil-based products just for shelf life.
that makes absolute sense. I just can't, I
Yeah.
don't see on their COA which one it is, but we'll find out. But either one I think would be fine. João?
Yeah, no, my main concern would be about the oil, like in the ear, if that would be harmful. But you bring up a good point about how long it lasts, right? It makes sense. Like if you have like something that's water soluble, it's something that evaporates, and then you need to reapply it more often. It does make a lot of sense.
Hmm. Okay, fantastic. Elwood, I think we will be beginning to do some topical ear application. I think this will be a positive move. Okay, just as we begin to close, Elwood does have a question that, if you feel comfortable, Elwood, I'd love for you to bring up. We are connecting them with an in-person practitioner, so we're going to get some more hands-on modalities, hopefully some acupuncture, some laser therapy, I think would be amazing, all of that. But Elwood, do you want to ask the question to the group that you sent me, or I can read your text? Do you feel comfortable asking it?
Milo, it's more of a, I don't know if it's a neurological question or a cardiological question, but one of the things that is mysterious to us and a little worrisome is that when he's lying on his stomach, he
Hmm.
tends to have a lot of head and neck trembling, and it seems to correspond to his heart rate. I mean, as I touch his head and his ears as they tremble, it feels exaggerated with each heartbeat. And we've wondered whether it has to do with his vagus nerve and the position he's in, because that's the only position where we notice it. But I did want to just put that out there in case anyone had any thoughts on it.
Yeah. Any experiences or thoughts? I think the pet parents don't necessarily perceive him as uncomfortable, and
No.
sort of different than like muscle trembling, which has been in his history in the past, but a very particular body position. Again, think little Boston Terrier, deep chest, legs outstretched. And so like a vagal nerve tone change with a sinus arrhythmia was something that had come up as a potential, but not quite sure.
Yeah, I don't think I ever seen anything like that. It's more like head and neck, you said?
Yes, it is. Like
Mhm.
you can see it from across the room because his ears will sort of vibrate with each heartbeat.
And you can see like in a rhythm, let's say like
It
that.
seem it seems to be. It might be distinct, and it just the heart rate is then laid on top of it, and so you notice it
Mm.
more. But
Mhm.
it's sort of a head and neck trembling, like he's cold.
I don't think I ever seen anything like that. It makes sense about like the vagal tone. It he does have cervical issues, right? So
Yes.
it might be correlated, but I'm not really sure. I don't think I ever seen anything like that. We do see some head trembling with different issues, but I don't think I ever saw something like in the rhythm of the heart. That's the main curious piece.
We could. I realize it's a big question for the last minute, but Milo has completed a round of chemotherapy. There was a little bit of reduction in the tumor size in his prostate at the very beginning, but then after that, it has just stayed the same. And so the oncologist feels that that's not bad news. It's good news that it kept the same size for most of this period. The question now is whether we resume a second round of the same chemo, try and take a chance with a new form of chemo, move on to radiology, which I think will be radiation rather, which would be very hard for him because of the sedation required,
Mm.
or switch to an oral chemotherapy medication that's targeted.
Elwood, is this oral medication the same one that he used in the past, or is it a new one?
So in the past, he's had, I guess it's called infusion. He's
Okay.
had his chemotherapy injected or infused. This is a tablet, so I don't. It's not the same. But the doctor said it's generally considered targeted for this type of cancer.
Okay. Is it Palladia?
Oh,
Did she
uh,
bring?
it's a good question. I'm afraid I don't know.
Yeah, I don't
Okay,
yet have the oncologist report, so we don't have drug names. We just kind of have the generic question.
I see. Yeah, I don't have any experience with radiotherapy. That's something that we are very limited with here in Brazil. We don't even do that in my city where I live. Patients who have indications of doing radiotherapy, they have to travel to another state to do that. Very few do. And my patients, they never done it, so I don't have any experience with that. My experience with patients doing chemo is very variable. It depends a lot on the dose that they're using, which medications that they're using. I've seen some patients having some major side effects from chemo. One patient of mine actually passed away after the first section. I don't know which medication was used. And other patients, they do chemotherapy and they look like they are not receiving anything. They behave as they were in the past. So that's very hard to tell. Usually, I try to work with specialists, and I always try to advise pet parents to follow the oncologist guidance because they know more about the medications that they're using. I know how concerning it is because it is something that's unpredictable, and sometimes we don't know what to expect. But I think it is something that it needs to be approached with the oncologist. It is very hard, at least for me, to tell right now, especially since I'm not following the case since the beginning and I don't have all the information of the medications that the specialist would use. It's a hard decision, and I'm sorry that you have to do it, Elwood. It is tough. I mean, with my dog in the past, she was diagnosed with cancer 2 years ago. She passed away last year, was 1 year after. I've done the surgery, but for myself, I decided not to do the chemotherapy because I was unsure about it, how she would react. But it's a tough choice, right? It is something that it is unpredictable, and it's very hard to tell the outcome of it. And the radiotherapy, I don't know exactly the side effects. I'm sorry. I don't know if you do have some experience with patients with radiotherapy, Dr. Andre.
No, I have to say that my answer mirrors Dr. Gewehr's pretty closely, Elwood, and we can talk about more pros and cons of each, but I yeah, we can absolutely kind of go into a little bit more detail there in another conversation, except that my kind of overarching thought is I don't have enough familiarity with the individual chemotherapeutic agents to make a kind of big top level suggestion. Does anyone else have a thought or comment they want to add in? Experiential words of support. We love Milo. And I echo Dr. Gewehr. It's a tough position to be in as a pet parent. There's hard to know what some of those right choices are. Okay. And
Yeah,
with that,
I'm
yes,
sorry.
Dr. Gewehr has another comment. Go ahead.
Just for us to finish up, Elwood, I don't think we have a right choice. It depends a lot on the personal experience of the pet parent. It depends a lot on what you think is best for Milo. The good news is you have done one round of chemo and you have seen a reduction in the tumor. And I think that's the good news that we need to focus on. If it is not the same chemo that he's done in the past, I mean, it's always unpredictable. But if he's done the first chemo and he didn't have side effects, if it was the same medication at the same dose, we can predict it a little better because we saw the first reaction. But if we change the medication or we change the modality, it's very hard to tell. And it's very hard. I mean, even oncologists, I guess it's not that they don't know, is that it is unpredictable. Some patients react perfectly, and some patients have side effects that are very severe. So it's very hard, but
All right, everyone,
Thank you
thank
very
you
much. Thank you all.
so much. We will close today's office hours. This has been so much fun. Any comments about format before we close? I definitely have really enjoyed the conversation and community building.
Yeah, absolutely loved it.
Amazing. Elwood, thanks to you and Milo for allowing us to use his case. I will touch base with you offline in our WhatsApp group just to make sure you don't have any other questions. And remember to join us again here in Dr. Gewehr's first Tuesday office hours, where we will also bend his brain with other cases in the future. So send us your questions. This is a really fun time for us to share. All right, we will see all of y'all soon. Have an amazing day.
Thank you.
thank
Thank
you
you
so
all.
much for being
Bye,
here.
guys.